Hello, welcome back to this channel where we talk about the basic medical information making a big difference. Kindly, if it's your first time, consider to subscribe, and for the returning subscribers, thank you so much for always checking on this channel. Last time we looked at acid, reflux and GERD. We looked at the difference between the two. We looked at the symptoms, and we looked at what worsens the symptoms of acid reflux and GERD. Today we are going to look at the cause. What causes acid reflux and GERD? My name is Rebecca Murangi, and this is the best place to be. If you remember, when we looked at acid reflux and GERD, we mentioned of some mechanisms failing to work properly, which lead to these conditions. Today, let's look at these mechanisms. What are the mechanisms which fail to work, hence leading to these conditions? For acid to get into the esophagus, it needs to get past the valve at the bottom of the esophagus. That usually keeps the things from coming back up. This valve is called the lower esophageal sphincter, or less, if you can shorten it like that. Now, the lower esophageal sphincter muscle is a circular muscle actually, which opens when you swallow and then closes again to keep the substance in your stomach. It also opens a little to get gas bubbles out when you have hiccups. Acid reflux happens when your lower esophageal sphincter muscle weakens or relaxes enough to let the acid pass. Let's have a look at these diagrams. Maybe they'll make us understand more about this condition. I have 3 diagrams here. The first one shows a healthy stomach. Now, we have the esophagus, the diaphragm, this is the stomach, and then this is the lower sphincter muscle, which is closed. Actually, it's closed fully, if you can have a look, because the stomach content is well kept in. But when this sphincter muscles relaxes, all opens, all weakens, it makes this stomach content to start escaping through the esophagus to the throat. Now you can see the lower sphincter muscle is open, allowing the acid reflux. We can say this is a GERD stomach because of the acid content or stomach content escaping through the lower esophageal sphincter muscle. Now, if we cut this part, let's have a look on the last diagram. Now you can see how the acid is escaping through the esophagus. Now this is what we call acid reflux. Up to there, we have understood what really causes the acid reflux. We have mentioned the lower sphincter muscle relaxes, all opens, and remember we mentioned the food we take should move one way, meaning downward. But when it starts moving back, what you call backwash, we mentioned the symptoms. That is what you call acid reflux. Many things can contribute to the weakening of your lower esophageal sphincter muscle, which can either be temporarily or permanent. Let's look at some of the common causes. Apart from what we have looked at, what are the common causes of this acid reflux? One is what we call hiatal hernia. Hiatal hernia are very common. Pregnancy can cause this common condition, and especially the pregnancy hormones. Obesity, when you have a lot of weight, actually can contribute to this condition. Those who smoke, if you smoke, either you are an active smoker or a passive smoker, contributes also to this condition. If you have had surgery in your chest, it may harm your abdomen, which may actually injure also your esophagus. Another thing is medications. A lot of medications can cause this acid reflux. We have Benzodiazepines, that's a type of sedatives. You have calcium channel blockers. These are medications which are used to manage high blood pressure. You have tricyclic antidepressants, which are used to treat depression and pain. We have NSAIDS, non-steroidal anti-inflammatory drugs. Example, we can have aspirin and ibuprofen. They can cause acid reflux. We have theophylline. Theophylline is a common drug which is used to treat asthma. We have hormone therapy. Hormone therapy, these are medications for menopause. To take coffee, it contributes to these acid reflux cases. Those who take chocolate, alcohol, actually we mentioned it last time, mint, garlic and onions. Actually what they do, they may cause your lower esophageal sphincter muscle to do what? To have a relaxing effect when you take them in high doses or in large quantities. So also those who take foods which have high amount of fat in it, fatty foods. If you take fatty foods and then you sleep immediately, that one is a reason as to why sometimes when you eat a fatty meal at night, it's not very nice. Use a small amount of fat to cook your foods, and when you eat at night, don't sleep immediately. Have some time to relax, 2 to 3 hours before you go to do what? Before you go to sleep. So this acid reflux case, all GERD conditions are supposed to be managed. Some can be managed at home, but severe cases can be managed at hospital. So up to this point, we have actually looked at what causes this acid reflux, and we have looked at some common causes of this acid reflux. We have mentioned of hiatal hernia, pregnancy, obesity, smoking. We have some medications on when you have chest surgery, which can actually, especially on the upper abdomen, which may have injured your esophagus. And also we have looked at some causes, especially foods which contribute to this cause. Now in the next video, we are going to see the diagnosis and the management all together on how this condition can be diagnosed, the complications and the management. Thank you so much. Continue subscribing and let's meet in the next video.